Hello and welcome to the program. I'm Wang Guan in Beijing. China has finally and significantly relaxed its COVID control policies, which had been a hallmark of Chinese society in the past 3 years.
On Monday evening, China announced that it will cut quarantine requirement for inbound travelers starting January the 8th, 2023. Mandatory quarantine for international travelers to China, which has been in place for nearly 3 years, will be a thing of the past. Meanwhile, mass testing is no longer required. The virus is also downgraded from top category A infectious disease to now category B disease.
While the resumption of freedom of movement and economic activities are causes for optimism in the long run, and people are breathing a huge sigh of relief, a dramatic rise in infection is also straining the country's public health system as we speak. What can be done at this point to address stress and shortages in face of mass infection in major Chinese cities? Is China about to see the end of the tunnel after a grueling 3-year-long battle against COVID? I'm joined by Dr. Jin Dongyan, Clara and Lawrence Ford Professor in Precision Medicine at the School of Biomedical Sciences at the University of Hong Kong. Dr. Jin, welcome to the Hub on CGTN, and thank you for doing this. Let me ask you, when China relaxes COVID policies, some experts said asymptomatic cases or mild cases are expected to account for, 90% of all infections? But in reality, many people feel that that is not the case, right? The majority of people said they either have fevers of up to 39 degrees, or they have severe body aches and they have severe throat pain. Was there a miscommunication?
The major subset of people who are asymptomatic or have mild diseases, you will never know now, because there is no nucleic acid test, there is no antigen test. So those who are asymptomatic or those who have mild symptoms, it would be very difficult to identify them. So only the tip of the iceberg will emerge. And these are those who have slightly more severe symptoms. So these symptoms also is like a very sore throat or something, but still, according medically, it is still categorized as mild diseases. And actually, according to the 9th version of the guidelines, it could even be categorized as asymptomatic infection, which is not right. I don't agree that category, that pathetics, but in reality, because according to the guideline, you have to have CT imaging evidence to diagnose a COVID. So nowadays, there is no CT imaging on most people's. So these people could not be diagnosed, and they could be categorized into asymptomatic infection.
But on the other hand, Professor Jin, we do see images of people lining up at emergency sections of hospitals in major cities. Some people shared their ordeal, the waiting hours at fever clinics. Some complain that they simply cannot get essential medications such as ibuprofen or Tylenol. How much of a stress, how much of a strain is this wave of mass infection on China's public health system?
So this is actually well expected, because this is an explosive outbreak or a tsunami. So millions of people have been infected. So if everyone rushed to the hospital, then all the hospitals will collapse. So that's the reality. But it is not ideal that even the anti-cold medicine were not available, and people have just to line up. So actually, 99% of those who are infected, they don't need to go to the hospitals. However, their mentality will still be to go to the hospitals, and that's actually an ordeal, and it's actually not unexpected, but that's the reality. So what we can do better might be to promote the virtual medicine, e-medicine, or to redirect these people to the community hospitals. Because if everyone goes to the big hospitals, then all the big hospitals will collapse immediately. So that's well expected. what we pay more attention to are the number of severe cases, particularly in the ICU and also those who need hospitalization. These numbers are more important than the number of confirmed cases or the number of people who are infected.
Other than e-medicine, what are some of the other measures that public health officials and hospitals can do right now to deal with this sudden upsurge in COVID infections?
So
what would be your advice?
The most important thing to do, which we have been advising the Chinese authority, that they should actually buy more Paxlovid from Pfizer, because Paxlovid is the best medicine so far that can save the lives of a lot of people who are over 60 years old or have underlying diseases. Because only in these age group that are over 60 or have underlying diseases, the drug will have benefits. In those who are 49 to 64 years old, there is no benefit. So even if they stop the medicine, stop the drug, and it's useless to them. But you have to give this drug at the first time. I mean, as soon as the person is diagnosed, either by RNA test or by antigen test.
Before showing symptoms, or even before showing symptoms, right after diagnosis?
Yes. Only if given at that early time, the drug will be helpful. If when severe disease develops, then it's again useless. So in the age group of, according to Israeli data, in the age group of over 65 years old, and those who have at least one underlying diseases, it reduces deaths by 81%.
Wow.
So that's actually a drug that can save lives.
Yeah.
So that's why we have been telling them that they should stockpile a lot of these, so that and give them. I mean, they have to design a very good mechanism to distribute the drug, because if it goes to those who do not need the drug, it doesn't help. It's actually almost useless. There is no benefit.
Talking about the elderly and the patients with chronic diseases or underlying diseases, Dr. Jin, they're more vulnerable to the virus, as you know, better than I do. How can we protect the vulnerable groups at this point?
So the most important thing, again, is to try to decide. I mean, it's already a bit late, as you said, that they have decided to distribute the drug in the community center, but that's the right direction to go, and that will save a lot of life, because also it has already the peak of the tsunami has already passed, but still there are a lot of people who might have severe diseases, and these people you have to kind of compete with the virus to give them the drug earlier but not later. That will be the best time for the drug to work. And the second thing is actually to protect the vulnerable. And these include the general, the public education. So there are a lot of people who are infected, and these people should not get contact with the vulnerable people, the elderly people or those who have underlying diseases. So you just have to avoid seeing them, at least when you are very, very infectious. So that's actually a very important message.
Talking about vaccination, many people are debating right now if they should just get infected and gain immunity towards Omicron, or should they go vaccinated or boosted? What would be your advice?
So for those who have not been infected, vaccination is the best option. And that will actually at least protect you from getting severe disease or death. But you have to have at least 3 doses of the inactivated vaccine. Or for those vulnerable people, they actually need 4 doses if the third dose has already been over 6 months or even a year. So that's the most important message that we need to pass on to the general public, that only 3 doses or 4 doses can protect them better.
All right. And then when we talk about the efficacy of vaccines, many people are skeptical. They're skeptical of the efficacy of, let's say, their homemade domestic Chinese vaccines. They're like, perhaps Western vaccines are more effective in that regard. How would you compare Chinese vaccines with their foreign counterparts?
The reality is that people only have access to the Chinese vaccines. So it is important that they have 3 doses or 4 doses, and only these 3 or 4 doses could protect them against severe disease or death. So the Chinese vaccines are indeed efficacious in protecting people against severe disease or death.
All right. Any final thoughts on the current situation with mass infection and people are, struggling against time to deal with this situation, Professor Jin?
So actually in Beijing, the peak, as I said, the peak has already passed. So the worst time has already gone. So, however, it is still very challenging to reduce the severe cases or deaths. So that should be our first priority. And we should ratify all the measures, including to distribute the Paxlovid to those in need, and also to protect the most vulnerable people. So these would be the first priorities. And also in the hospitals, they should also mobilize all different experts to try to save lives.
All right, Professor Jin Dongyan, thanks so much for your expertise. Thank you.
Thank you.